So today I'm going to be treating the hip using the Enraf Nonius Tecarpuls. We're going to the hip and we're going to go into trochanteric bursitis. You'll see here the machine has pre-selected level 8 and 6 minutes. It depends how big the bursa is as to how many minutes you'd want to do. I'm actually going to come down a little bit here to 4 minutes. This is a different way of using the Tecarpuls. I'm going to demonstrate how you would use the Tecarpuls to decrease the circulation to the bursa, not increase the circulation to the bursa. And to do that, first of all, I'm just going to earth the patient. They're pretty standard. Just spread out the contact medium, and then we'll just apply that underneath the patient. It doesn't really matter what it is. I'm going to show you a thermal image of the area just so that you can see what's going on, but we're not really interested in the increase in temperature in the bursa. We don't want to increase the temperature in the bursa. So if we have a look up here onto the hip, you'll see it's the map of the thermal image that I'm interested in. There's pretty much no heat around the area. So I'm now going to put the contact medium onto the area that I'm actually going to go around, and I'm going to show you how I go around the bursa using the contact medium. So I'm going to start coming around the bursa now in a donut shape around the bursa. The reason I put the contact medium on in the way I have, straight across the top of the bursa, is to allow me to visually see that I'm not actually going over the top of the bursa with the Tecar. I'm actually avoiding the bursa. So if you look at the contact medium, you'll see that in the centre I'm making a circle, like the centre of a donut, where there's a hollow in the middle of the contact medium. And that's telling me that I'm not actually going over the bursa. I'm going around the edge of the bursa in a large donut shape. The reason I'm doing this is I'm trying to draw circulation to the area around the bursa rather than put heat and circulation into the bursa, which is just going to further increase the inflammation. So I'm going round the bursa in this donut shape fairly rapidly. I'm still using circles within the donut. And we'll keep moving around like this. You can probably see by now that the contact medium is making a, almost, you could describe it as a volcano shape in the middle there, showing me that I'm not actually going up and over the bursa. I'm just coming around the bursa. And the theory here is that the increased temperature and increased circulation around the bursa will draw circulation, draw temperature away from the bursa, and hence decrease the inflammation in the area. Now, as you saw earlier, this is a 4-minute treatment, so I'm going to fast forward at this stage to the end of the treatment and show you the thermal image map so you can see how exact the Tecar can be at increasing heat without increasing heat over the whole area. This would be almost impossible to do if you weren't using a handheld applicator. So we'll fast forward now and look at the thermal map at the end. So we're approaching the end of the treatment now. As you can see, I've got my contact medium in a volcano shape in the middle. I've done my donut. We'll bring the thermal camera back in now so you can just see the effect I was looking for here. Remember, we're trying to get heat and improved circulation around the bursa and away from the bursa, rather than actually into the bursa itself. And so I'll bring the thermal camera back in here. Let me just get a good view of it for you. So if you have a look here, you'll see the red thermal area going round like a donut, and in the centre there at the top you'll see there's blue and dark blue, indicating that that area is still cool on the bursa, and I've just increased the heat around the bursa rather than within it.